we just want to welcome you to our first virtual event at the Antony Institute for Aesthetics and Plastic Surgery. It's our pleasure to have you join us for the Season of Radiance virtual event. I want to introduce members of my team, amazing people. I have Erica, who is our PA injector, and I have Marissa, who is my patient care coordinator and also a licensed esthetician. We're going to be talking about so many things today, and we're excited that you're tuning in. As winter's approaching and the holidays are right around the corner, we want to support this idea of self-care and self-love. And as women, we're just so busy helping others that sometimes we forget about ourselves. And it's important to remember how we can look and feel our best. We deserve a season of radiance ourselves. That's why we're excited to share our favorite treatments here at the Antony Institute. And stay tuned after the presentation. We'll have a fun Q&A session and a sneak peek at our exceptional values. So in my personal practice, what I'm seeing, of course, I see a lot of facelifts and body contouring as well as, breast surgeries, but of recent we've seen a lot of blepharoplasties. And the reason I think that is because, these upper eye lifts are procedures that just have a short downtime. And, we talk about the eyes being the window to the soul, and it's how we connect with each other. And so it's really important that we feel rejuvenated and refreshed and feel like our best. And oftentimes when the eyes are tired, people don't perceive us that way. So these surgeries are great because usually the recovery is within 10 to 14 days and people are kind of back into their life, and it really makes such an impactful difference to the eyes and the whole face and just the way people feel about themselves. So they're just holiday ready. So medical grade skincare is different than what you buy over the counter. It's much more potent, much more powerful, and it really has to do with the carriers that inside, as well as the formulations. What we find, and especially in my skincare line, which is A New Science of Beauty by Dr. New Antony, it's really about having that luxe feeling, it being very efficacious, and using the best ingredients. We want it to be good for all skin types, even people with sensitive skin, as well as all different complexions, and really cause collagen formation, improve the skin tone. You want to see a difference. And so I think it's really important to distinguish medical grade from the things that you buy over the counter, because if you're paying all that money, you want to make sure you're getting the maximum impact. So it's laser season here at the Antony Institute, which technically is from October till April, though we do laser year round. My favorite energy device is the Helix CO2 laser. It's actually two lasers in one. So you get the CO2 ablative that targets the superficial textural issues, plus 1570, which puts these cones of heat in, and that causes collagen induction as well as thermal contraction. Because it's a newer laser, it really has very little downtime, and also it's less painful. So we just use topical numbing because that energy goes in and out without causing as much pain as the older lasers. So it's a really great option for women looking to resurface the skin and get more tightening and collagen in their skin this holiday season.
So if you have a big event coming, you definitely want to try to get your Botox a month ahead. That's because it's going to take at least a week or so to see the results begin, and a full 2 weeks before your muscles respond. Even at the 2-week mark, you're going to need a little bit more time for the muscles that are not treated to come into balance with the treated muscles. That's when Botox looks its beautiful best. So my most requested filler treatments are lip filler and cheek filler. Everyone loves a full, voluptuous, beautiful lip, and everyone appreciates a high, youthful cheekbone. But what you may not think about is filler in other areas of the face. So treating areas like the temples or imbalances in the chin, or even a little adjustment for the under eyes can also give a beautiful, soft contour to the face that makes a huge difference. So talks for each decade of life can be a little different. If you're in your late 20s or early 30s, you want to think about baby Botox. Those are just micro doses, and maybe just 2 or 3 times a year, we're going to use those little doses to slow down the aging process and prevent the onset of those future lines. If you're in your 30s and 40s, you want to think about regular tox treatments. So every 3 or 4 months, we're going to treat the upper face primarily because that's going to help lighten and lift the features of the upper face and also smooth out lines. If you're in your 50s and beyond, maybe think about tox for the upper and lower face. Treatments like the chin, the neck can keep everything looking smooth and keep us away from those harsh expressions.
My 2 favorite pills are the Cosmelan and the Enlighten pills. So the Cosmelan I love recommending it to my patients that have hyperpigmentation and melasma. I choose Enlighten peels for patients for all skin types that have fine lines, wrinkles, or even some hyperpigmentation. So it's perfect for all skin types. My signature facial, I love to start with a double cleanse with a papaya cleanser. But what makes it so special is that I include a nice, gentle luxury massage. As moms, as wives, we go through a lot of stress. So it kind of gives that unwind moment to relax. And of course, with the holidays coming up, it's that perfect prep time. Microneedling is small needles that penetrate the skin, producing collagen, which helps fine lines and wrinkles, also helps release the skin pigment, and reduces pore size.
Welcome to Antony Institute for Aesthetics and Plastic Surgery. I'm Sarah Garwood, the Physician Assistant Head of the Weight Management Program here at the clinic. A GLP-1 drug is a glucagon-like peptide-1 drug that mimics the natural hormone that we have in our bodies. It helps with hunger, decreases your hunger, increases your fullness, and slows that gastric motility in your gut. Good candidates for this medication are people who have tried diet and exercise for many, many years without any success. Also people who are trying to get ready for a surgery, sometimes a knee replacement or cosmetic surgery like breast augmentation or a tummy tuck, and you want to lose a little bit of weight. So we have lots of good candidates for this medication. The key to successful weight loss using GLP-1 medication is consistency. So making sure you are giving your shot weekly, communicating with us as your healthcare professionals, and communicating your needs about what you like about the medicine, what you don't like, so we can achieve your ultimate weight loss goals. We offer both tirzepatide and semaglutide drugs. I tend to favor the tirzepatide medication because it's a dual action molecule. It has a GLP-1 and a GIP. So both of these work to help decrease your hunger and increase your fullness. And what we also like to do with our medication here is compound it with B12. And B12 is wonderful for fat burning, and it helps decrease that nausea that a lot of us get with these medications. So everyone has a different response to the GLP-1, so it's really whatever works for you in your unique situation. Some patients are on these medications for 3 to 6 months. Some patients are on these medications for 12 to 24. Ideally, you can be on this medication for a long period of time. But say you've lost a lot of your weight and you're at your happy weight, that's where you want to be, you don't want to lose any more. What I like to do is slowly decrease the dose. So we can spread it out by a few weeks at a time, we can microdose, we can do whatever you want. Now, if you were to stop the medication suddenly, a lot of times those hunger cues come back really rapidly, so that's why I like to slowly decrease it. So then you can achieve that healthy hunger cues and keep that successful weight loss that you have achieved.